All we have left at this point are the muscles of your leg. So here we go. Let's take a look. Once again, if we were in the classroom, we have these big giant leg muscle models, and that's what we would have in front of us right now. Every one of you at every table we would have this, and I would be going around from table to table and pointing at the muscles, and you could be asking me things. It's so difficult when we're doing this online, but we just have to do the best we can with it. So psoas major and iliacus flex and rotate the thigh laterally. So you can see those. Where do you suppose you find iliacus? Well, by golly, iliacus runs right along the iliac crest. And then psoas major, see the muscle running all the way up onto the spine? That's psoas major. That's a very powerful muscle. It's a kicking muscle, all right? Psoas major flexes the lower leg. Remember, flex is the kicking motion. We're not talking about at the knee, we're talking about at the hip. So when you kick forward, that's psoas major. That's the powerful, and you can see there, see where it says 12th rib? That's where it is. I know they're showing also quadratus lumborum there and psoas minor. We don't have to pay any attention to that. Look at psoas major. Psoas major is most of that muscle that you see coming from your leg all the way up onto your spinal column. And that's why it's so powerful, because it's basically your spinal column is pulling your leg up towards the spinal column. That creates a very powerful forward kicking motion. Tensor fasciae lati, it's not the latte mocha cappuccino, it's the tensor fasciae lati. You can say fasciae, latte, lati, usually AE. Actually in Latin, in scientific Latin it should be pronounced E, but a lot of people pronounce it A. I don't care. Pronounce it any way you want to, just spell it correctly. So remember fascia, we looked at the muscle tissue. Fascia, remember, we have the superficial and the deep fascia. Fascia is connective tissue. Latte, like lateral, means on the side. And tensor, tension. So what does the tensor fasciae latae muscle do? It maintains tension on something called the iliotibial band that we're going to see coming up in just a moment. The iliotibial band is a giant tendon that runs all the way down the outside of your leg. And that tendon is kept taut, kind of like you'd pull a rope taut. Tensor fasciae latae is the muscle that pulls that rope taut so that there's no slack in it, okay? Don't have to know origins and insertions. Pectineus flexes and adducts the leg. You can see it there. Pectineus is normally covered up by a lot of other muscles. So on most models and charts, you only see a little tiny bit of it, and that's all we're seeing here. It's what we call a deep muscle. Some structures are deep, some are superficial. So deep means it's down underneath a bunch of other stuff. Superficial means it's up on the top. So pectineus is a deep muscle. Don't have to know origins, insertions. Gracilis, that runs down the very inside of your thigh. So you can see it right there. It's an anterior view, so you only get a little tiny view of gracilis. But basically, like the inseam on your pants, like if you wear jeans, you know the inseam that runs down the inside of your thigh, that's where gracilis is. So what does it do? It adducts and medially rotates the thigh. Think about it. If you have a muscle on your inseam, when it contracts, what's it going to do? It's going to pull your leg towards the midline, okay? Because it's coming from the pubis onto the tibia. So it's basically pulling your whole leg towards your pubis, towards your pubic bone. Now the tendon of the quadriceps femoris muscles I mentioned before, that connects rectus femoris to the patella. So there you see it, the tendon of the quad muscle, quadriceps femoris. And then the patellar ligament connects the patella to the tibia. A lot of people you'll see call that whole thing the patellar ligament, and even doctors will do that, and nurses. And once you get out of this class, you can call it whatever you want to. But in here, we're still going to make a point of the fact that technically the part above the patella is connecting a muscle to a bone, therefore it's a tendon. The part below the patella is connecting a bone to a bone, therefore it is a ligament. So looking then at the inside of your thigh, we have the adductor muscles. These are all going to pull your leg towards the midline. Kind of like when you snap to attention and your feet come close together, that's adduction of the leg. Adductor magnus adducts and laterally rotates. Don't have to know origins, insertions. Adductor longus adducts and flexus. So they're both adductors, but look at them right now. Look in the diagram. Adductor magnus, adductor longus. Unfortunately, because we have an anterior view, you can't see the fact that adductor magnus is much wider than adductor longus, whereas adductor longus is a longer muscle. So unfortunately, from this view, you can't really tell that. You just have to take my word for it that adductor magnus is a wider muscle, and that's why it's magnus. And longus is a longer muscle, that's why it's longus. Don't have to know those origins and insertions. I talked over the slide transition. Never supposed to do that, I'm so sorry. So here is the iliotibial band or iliotibial tract, thickened band of fascia on the lateral aspect of the thigh. And then notice, in the muscle diagram on the left side, see how the iliotibial band is that big thing of white tissue, goes all the way from your tibia all the way up the side of your thigh, and then see how it connects not to gluteus maximus on the back, your big butt muscle, but on the anterior side. See how it connects to a little chunk of muscle up there? That's tensor fasciae latae. That's the muscle that keeps that band taut, keeps it tight, okay? That adds a lot of stability to the leg. Runs from the iliac crest all the way down to the knee, kept taut by tensor fasciae latae. Iliotibial band syndrome is a common cause of lateral knee pain in runners and cyclists, and it can get to be really severe pain. My son was a cool long-distance cyclist. He at one point was riding from Pennsylvania to Arizona, and he made it all the way across the Midwest and everything. And he had a little bit of IT band syndrome. They sometimes call it, instead of iliotibial, just abbreviate IT. And it was going across the Rockies that his IT band syndrome got to be so bad that he couldn't continue. It was really too bad. He had to quit partway through. But it can be very painful. Runners and cyclists seem to be the ones who suffer from it the most. All right, muscles that move the thighs. So we're talking about muscles that move your whole upper leg. So gluteus maximus extends laterally and rotates the thigh. Don't have to know origin and insertion. Gluteus medius underneath it, and then gluteus minimus underneath that. So you got your big butt muscle, you got your medium butt muscle, and you got your little tiny butt muscle. So what do? They extend the leg. So that's like kicking backwards. So if you want to kick behind you, kind of like, you know, the way a horse kicks behind it, that's your gluteus maximus. Gluteus maximus, by the way, is actually, by mass, is the largest muscle usually in the human body. It's huge. Partly because when we walk, you know, it helps support our weight and it helps us walk all day long, stabilizes us as we're walking. So it's a very powerful muscle, keeping us upright, keeping us walking. Latissimus dorsi, I think, is the second largest muscle by mass in the human body. Again, don't have to know those. Piriformis, you can cross that off. There's no point in getting into that. It doesn't show up very well on most charts. We're going to leave it off for the pandemic. Muscles that move the leg. All right, so we're now talking about the lower leg. We're talking about muscles that move your tibia and your fibula. All right. So rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius form what we call the quadriceps. Quadriceps means four heads. What do? They extend the leg. So extend the lower leg means as though now you're keeping your thigh still, you're just kicking from the knee. That would be extension of the leg. That's what your quads do, and they're very powerful. That's why kicking, you know, from your knee is a very powerful kick. When you combine both your thigh and your knee, you can really kick hard. That's how those soccer players can kick that ball practically all the way across the field, lengthwise. So yeah, we're good at kicking. Powerful muscles help us do that. So the quads, again, four of them. That's why they're called quads. So rectus femoris is one that runs right down the middle. Rectus on the midline, femoris on the femur. So it runs right down the midline on the femur. Vastus means huge. So you've got the huge muscle laterally and the huge muscle medially. Vastus lateralis, vastus medialis. Vastus intermedius is between the other two vastus muscles, but it's normally covered up by rectus femoris. So you can't see it unless rectus femoris gets cut away. So see in that illustration, they have, in fact, cut rectus femoris halfway down so that you can see vastus intermedius underneath it. Okay? Origins, insertions, don't have to know. Sartorius, cool name, cool muscle, longest muscle in the human body. Runs diagonally across your thigh. So see, in the diagram on the left, comes from the upper left and goes down to the lower right. Sartorius, just a skinny little band of muscle, but it runs all the way across, diagonally across your thigh. All right. Sartorius is the longest muscle in the human body. Why is it called Sartorius? Word Sartorius derives from sartor, the Latin word for tailor. This is just a little side info. You don't really have to know this. Over time, they don't know exactly how the word came to be. Clearly refers to tailors and sewing. So one thing is that tailors would sit cross-legged, and if you stand up from a cross-legged position, you have to kind of extend your leg and rotate it at the same time, and that's exactly what Sartorius does. So it's the muscle that basically allows you to go from a sitting cross-legged position to standing straight up. They also say maybe it was from the treadle on the sewing machine. I think the first one is more likely. That's what Sartorius does. You can read through that on your own. Alright, again, muscles that move the leg. We're talking about the lower leg now. We're talking about the tibia and the fibula. So, biceps femoris. That flexes the leg and extends the thigh. This is one of the muscles that forms what they call your hamstrings. Your hammies. If you're one of those guys that goes to the gym, yeah, I got to work my hammies. Got to work my traps, my delts. Got to work my gastrocs. Biceps femoris is the most lateral of all the hamstrings. That's I always remember it that way. Biceps femoris is the most lateral of all the hamstring muscles. Then there are a pair of muscles, semitendinosus and semimembranosus. So they're over on the other side. Now here's the thing. You don't have to know origins and insertions. All three muscles together, indeed, known as the hamstrings, the hammies. Semimembranosus, notice it has an M in it, and semitendinosus has a T in it. So what happens is semitendinosus sits right on top of semimembranosus. So it kind of hides a lot of semimembranosus. A lot of semimembranosus is covered up by semitendinosus. So I remember that the T in semitendinosus is because it's on the top. And then semimembranosus has an M instead of the T. That's because it's the most medial of all the hamstrings. So again, the silly little things I have in my head that help me, if they help you, great. If they don't, then don't use them. But I always remember biceps femoris is the most lateral. Semitendinosus is on the top. And semimembranosus is medial. Okay? So, go ahead and make fun of me. You can't hurt my feelings. I don't have any. Now, muscles that actually move your foot and your toes. So these don't move your leg. These move your foot and your toes. So tibialis anterior. Where do you suppose you're going to find that? What's big and red and eats rocks? What color is an orange? Orange. Where was Mickey Mouse when the lights went out? In the dark. So tibialis anterior runs right alongside the tibia on the anterior side of your leg. It dorsiflexes. Remember what that means? That means to stand on your heels. It also causes inversion. So this is the one, if you feel your lower leg, you can feel your shin bone, right? So then go right over to the side of your shin bone, move laterally from your shin bone. You can feel tibialis anterior. It's a big meaty muscle in your crural region. Soleus is on the back side of your leg. I'm going to put all this up here at once. Well, all right. Yeah, so soleus. Soleus is a deep muscle. It's a big flat muscle that runs across your calf. Now we're going to see there are two other muscles that run on top of soleus. Soleus is deep underneath them. It's actually thin and flat. But in bodybuilders, you can often see when they do certain kinds of motions, all right, so it plantar flexes the foot. So when a bodybuilder stands on his or her tiptoes, you will be able to see the two big bulgy muscles. Those are the gastrocnemius. And then underneath there's a thin flat muscle. That's soleus. You can see that, okay? It really stands out. Extensor digitorum longus, what do you suppose that does? Extensor digitorum longus extends the toes. It extends the digits. Don't have to know origins insertions. Fibularis longus and brevis, old name for it is peroneus. Plantar flexes and everts the foot. So these are two muscles that run right alongside the fibula. So if you look on the right hand side of that diagram, you'll see both fibularis longus and fibularis brevis. Fibularis longus runs basically all the way from your knee all the way down to your foot, whereas fibularis brevis starts about halfway down and goes to your foot. So that's why one is called longus and one is called brevis. One is longer and the other one is shorter. Fibularis longus, so you don't have to know origins insertions. Okay. Now going along on the back, here you can see those are the two gastrocnemius, those two big bulges, and underneath them is the flat soleus muscle. See how you can see soleus on each side? That's because it actually runs underneath both of the gastrocs. It's a thin, flat muscle that goes across the back of your calf. The two big bulges are the two big gastrocs. Flexor digitorum longus. So this muscle comes down. What is it going to do? It's going to flex your toes. So in other words, it curls your toes. Flexor digitorum longus curls your toes. It also flexes the foot. So it's a very long muscle, runs from all the way up on your calf, all the way down underneath your foot. And flexor hallucis as long as you can cross that out. We're not going to deal with that muscle, so just cross that out. Okay, so flexor digitorum longus, here you can see, there on the left-hand diagram, runs from all the way down your calf, all the way down to your foot, where it goes underneath your foot. And then flexor digitorum brevis is only on the bottom of your foot. It's that little tiny one that we see there in the middle of your foot. So it also flexes your toes, but it's a much weaker flexor. It's not nearly as powerful. Okay? So those are all the muscles that move your foot and toes. And there's my friend Lucy. She wore those cool pants that show the muscles. Unfortunately, they're not anatomically correct. That's kind of too bad. But it's okay. I had Lucy pose for me and show you her cool muscle pants. And there's me with Lucy. Okay, kids, we're done with the muscles. That's it.